Hey everyone, welcome back to NurseBrain. Today we are diving into 10 critical questions for your PNLE 1, the Foundation of Professional Nursing Practice exam. If you are preparing for the upcoming board exam, these questions might just save your nursing career because they cover essential concepts that frequently appear on the test. Let's get started. Before we jump in, I want to remind you that mastering these concepts isn't just about passing your exam. These are fundamental principles you'll use throughout your entire nursing career. Let's break down these 10 questions one by one. Question number 1. Management styles. You discover some managers have a benevolent, authoritative style of management. Now here's the question. Which behavior will they most likely exhibit? Is it A, have condescending trust and confidence in their subordinates? B, give economic and ego awards? C, communicate downward to staffs? Or D, allow decision making among subordinates? Your 5 seconds starts now. The correct answer is A. Have condescending trust and confidence in their subordinates. Nurses listen to the rationale. Benevolent authoritative managers typically display a pretentious or condescending trust towards their followers. They maintain a control while appearing to value input, but their trust isn't genuine. This management style falls under Likhart's management system, where managers show some confidence in the subordinates but still maintain most decision making authority. Board exam top question number 2, nursing models. Nurse Amy is aware that which statement is true about functional nursing? Is it A, provides continuous coordinated and comprehensive nursing services? B, one-to-one nurse-patient ratio? C, emphasizes the use of group collaboration? Or D, concentrates on tasks and activities? Your 5 seconds starts now. The correct answer is D, concentrates on tasks and activities. This is a critical distinction. Functional nursing focuses primarily on completing specific tasks rather than providing holistic patient care. Each staff member is assigned particular duties based on their skill level. Option A actually describes primary nursing, while option B describes total patient care. Understanding these nursing models is essential for both your exam and your future leadership roles. Board exam type of question number 3, medication orders. Which type of medication order might read vitamin K 10 mg IM daily times 3 days? Is it A, single order? Is it B, standard written order? Or is it C, standing order? Or D, stat order? Your 5 seconds starts now. The correct answer is B, standard written order. Here's why. Let's break this down. A standard written order specifies medication, dose, route, frequency, and duration. Single orders for option A are for one-time administration. Stat orders for option D are for immediate administration in urgent situations. Standing orders, option C, are pre-established protocols for specific conditions without requiring a new prescription each time. How was your score so far? You guys following? Let's do question number 4. Fecal impaction. A female client with fecal impaction frequently exhibits which clinical manifestation? Is it A, increased appetite? Is it B, loss of urge to defecate? Is it C, hard, brown, formed stools? Or D, liquid or semi-liquid stools? Your 5 seconds starts now. Time is up, nurses. The correct answer, letter D, liquid or semi-liquid stools. Now listen to the rationale. This might seem counterintuitive, but it's crucial to understand. When a patient has fecal impaction, liquid stool can actually seep around the impacted mass, resulting in what appears to be diarrhea. This is often misinterpreted as simple diarrhea rather than a symptom of impaction. Patients typically don't have formed stools, that is option C, because feces can move past the impaction. They usually still feel the urge to defecate, contrary to option B, but can pass stool, and their appetite is typically decreased, not increased. Board exam type of question number 5. Otoscopic examination. Nurse Linda prepares to perform an otoscopic examination on a female client. For proper visualization, the nurse should position the client's ear by, here are the options: pulling the lobule down and back. B. Pulling the helix up and forward. C. Pulling the helix up and back. Or D. Pulling lobule down and forward. Your 5 seconds starts now. The correct answer is C. Pulling the helix up and back. This is a technique you'll see throughout your career. For adults, you straighten the ear canal by grasping the helix upper part of the ear and pulling it up the back. For children, you'd pull the helix down, pulling the lobule or earlobe in any direction won't properly straighten the ear canal for visualization. Board exam type of question number 6. This question talks about radiation therapy. Here's the question. Which instruction should Nurse Tom give to a male client who is having external radiation therapy? The choices are: protect the irritated skin from sunlight. B. Eat 3 to 4 hours before treatment. C. Wash the skin over regularly. Or D. Apply lotion or oil to radiated area when it is red or sore. Your 5 seconds starts now. The correct answer is letter A. Protect the irradiated skin from the sunlight. This is critical patient education. Irradiated skin becomes extremely sensitive and must be protected from UV exposure. Patients should avoid strong sunlight and use protective clothing or sunblock on treated areas. Option B and C aren't specifically related to radiation skincare. Option D is actually contraindicated. Patients should avoid applying lotions or oils to irritated radiation sites unless specifically prescribed. We are almost halfway through. Last 4 questions, make this one count. Board exam type of question number 7. Preoperative preparation. In assisting a female client for immediate surgery, the nurse in charge should encourage the client to avoid following preoperative medications. B. Explore the client's fears and anxieties about the surgery. C. Assist the client in removing dentures and nail polish. Or is it D? Encourage the client to drink water prior to surgery. Your 5 seconds starts now. Time is up, you guys. The correct answer is C. Assist the client in removing dentures and nail polish. Here's why. This is a safety issue. Dentures must be removed to prevent airway obstruction during anesthesia. Nail polish must be removed so that cyanosis can be easily monitored by observing the nail beds. Option A is incorrect because patients should avoid or void before receiving preoperative medications. Option D is dangerous. Patients should maintain NPO status before surgery to prevent aspiration. How is your score? Next question. Acute pancreatitis, question number 8. A male client is admitted and diagnosed with acute pancreatitis after a holiday celebration of excessive food and alcohol. Now, which assessment finding reflects this diagnosis? Is it A, blood pressure above normal range? Or B, presence of crackles in both lung fields? C, hyperactive bowel sounds? or D, sudden onset of continuous epigastric and back pain. Your 5 seconds starts now. Nurses, what's your answer? The correct answer is letter D, sudden onset of continuous epigastric and back pain. Listen to the rationalization, nurses, carefully. This is the classic presentation. The autodigestion of pancreatic tissue by enzymes results in inflammation, edema, and possible hemorrhage. This causes severe unrelenting epigastric pain or back pain. Options A, B, and C aren't typical primary findings in acute pancreatitis. Understanding these classic presentations will help you quickly identify potential emergencies in your practice. Last 2 questions, nurses, make this one count. Question number 9. Burn care. Which dietary guidelines are important for Nurse Oliver to implement in caring for the client with burns? A. Provide high fiber, high fat diet. B. Provide high protein, high carbohydrate diet. C. Monitor intake to prevent weight gain. Or D. Provide ice chips or water intake. Your 5 seconds starts now. The correct answer is B. You have to provide high protein, high carbohydrate diet. Now listen to the rationalization carefully. Burn patients have dramatically increased metabolic needs. A positive nitrogen balance is crucial for tissue repair, meeting metabolic demands, and fighting infection. Caloric goals may reach 5,000 calories per day. Option A would not provide adequate nutrition. Option C is inappropriate as burn patients need increased calories, and option D alone will be insufficient for hydration needs. Last question for today, board exam time for question number 10. Blood administration. Here's the question, you guys. Nurse Hazel will administer a unit of whole blood. Now, which priority information should the nurse have about the client? Is it A, blood pressure and pulse rate? B, height and weight? C, calcium, potassium levels? Or D, hemoglobin and hematocrit levels? Your 5 seconds starts now. Time is up, you guys. The correct answer is letter A, blood pressure and pulse rate. Here's why. Patient safety first. Always remember that. Establishing baseline vital signs is essential before transfusion to recognize signs of anaphylactic or hemolytic reactions. While option C and D provides useful information, they're not the priority assessment before starting a transfusion. Height and weight, option B, aren't typically relevant to transfusion safety. That wraps up our review of these 10 essential PNLE questions. Remember, you guys, understanding the rationale behind each answer is just as important as knowing the correct option. These concepts form the foundation of safe nursing practice. If you found this helpful, please hit that like button and subscribe to NurseBrain for more PNLE review content. Check out our related videos on medication administration and nursing management by clicking the links on your screen. Until next time, this is NurseBrain, inspiring greatness one lesson at a time.